first of all, I would like to make my thanks to the organizing committee, the principal, sir, Dr. Tanveer, who is constantly working in this direction. I'm very much pleased of his work and the dynamic principal of the institute who has given me the chance to say something regarding the molecular biology and what is the molecular pathology. So I'm thankful to Government Degree College who has time to time, who gives me time to time to call for a different kind of the work related to the ethical committee, related to the any program. So I am happy to as Principal Sir has told that I have been a close connection in this college because my father is my father was my section officer in this office, and that's why I am having the great affinity with this college. So after that, and all these things, I'd like to make start my work, which is the molecular biology. And molecular biology is how the molecular biology is related to the molecular pathology that I would like to get. But before starting to my presentation, also I would like to know from the audience do you have any idea regarding the molecular biology? What is the term? First of all, we need to know about the term molecular biology because so many things have made in this direction because my presentation, the era of the COVID, 2020, 2021, which was it was the year of COVID, in which the children knew about the molecular biology. Even the layman person, bankers, the person who are not involved in the laboratory and the other things, they are knowing what is the real time PCR, what is the efficiency and what is the use of the PCR. So, day by day, the necessity is the invention of everything. So that is why I would like to know from the audience that do you have any idea regarding the molecular biology? So molecular biology, if you go to the net, then you will search that molecular biology refers that the investigation of the anything at molecular level. But I would like to know that the molecular level is so many things. At the molecular level. Protein is also at the molecular level, and antibody, antigen, all these things are at the molecular level. So, what should be the right definition of the molecular biology? So, first of all, we need to know that what is the definition of the molecular biology, which is used in the terms of the molecular pathology. Okay, so strictly we need to understand that the molecular biology stands only for the investigation of the DNA and RNA. Okay, DNA and RNA. Not we will talking about the chromosome. The investigation of the chromosome is known as the cytogenetics. Okay, so that which is known as the karyotyping and other things in which they will go for the analysis of the chromosome at the various levels. But how the DNA is there? DNA is embedded in the chromosome. So chromosome is the vast. After that, the deep level is the DNA. After that, RNA and then the protein. We'll go into the next slide and then we'll discuss how the DNA, RNA works to identify the disease and how the different drugs are there to know about that. So first of all, we clear that what is the molecular biology investigation of the DNA and RNA. Only DNA and RNA, not chromosome. Chromosome, DNA, RNA, protein are the different things. So the investigation of the protein and the study of the protein is known as the proteinomics. The study of the chromosome is known as the cytogenetics. And the study of the DNA and RNA is known as the molecular biology. So moving to our slide. This is very important to know before every aspect of the molecular biology, which is the 3 milestones in the molecular pathology. What are the 3 milestones in the molecular pathology? First of all, the inventions of the DNA. If the DNA is not there, so how the molecular pathology will come into the existence? It is not possible. So 3 milestones in which the 1953, the invention of the DNA by Watson and the Crick. And do we know about that? Someone is also there in the invention of the DNA. Anyone can say? Watson and Crick was the Nobel laureate who had received the prize for invention of the DNA. And presenting a double helical model of the DNA form is also the base of the research. That is why I am also emphasizing that what went wrong that time. Because researchers have to do the one thing that if you have any idea in your mind, then don't share. Then don't share whatever the result comes in your lab. Then don't share. The history behind the Watson and Crick was the biochemist, and the Rosalind Franklin was the simple research scholar like you people sitting here, which is student. So double helical structure was in the hand of the Rosalind Franklin, and what the proteins and whatever the sequence of the ATCG was there in the hand of the Watson and Crick. So Watson and Crick were astonished that where the sequence of ATCG, the base are, it should be fitted into where. It was the problem with her. They knew that somewhere that a simple lady, a research scholar, has made a double helical structure, but they were not knowing that how the ATCG will fit into that. So these are two different things. How the ATCG will fit into the double helical model, and the Rosalind Franklin was not knowing that what there was a need of the combination of the two people. But what the Watson and Crick did that time, they went into the lab of the Rosalind Franklin and they stolen the data of that, the crystallography of the double helical model, and they fitted into the biochemistry, which was the adenine, thymine, cytosine, and guanine, which was the nucleotide of the DNA, and they fitted into it in a very few time. After that, they got the Nobel Prize after the invention of the DNA. But what happened to that lady? They gone mad just to know that my data was stolen and someone has fitted the data and published that paper. So it is very essential. That's why I have described that what happened that time. Because whenever the idea comes in your mind, then don't share, do implement, and try to publish the paper. Whenever you are not publish the paper of your work, it will be catched by the other people. So this is the world of the research. This is the scenario of the researchers. So that is why the patenting is also there. Every institute is giving the chance that whatever your data, whatever your result, is go for the patenting, go for the IPR right, in which you win the patent. It means the stamping is there. It means that is your data. So moving to the other parts of that. So after 1953, after 20 years, the invention of the PCR by the Kerry. But I will skip after the invention of the 20 years, the Human Genome Project was done. Human Genome Project is the sequence of the disease of everything made by the scientists of the USA in 2018. It means Human Genome Project was completed, in which how the PCR will work and the sequence of the DNA was available that time. So the journey of the molecular pathology is start from 2003 to 2023. So it's only the 20 years of the science, which is not involved in the modern medicine like the MBBS, in the curriculum of the MBBS, not the other Ayurveda, are not everywhere. It's a pure life science thing. Okay, So it is now the utility, and now it comes how that it is being used in the different pathology. People and the clinicians are knowing that how the molecular biology test is giving help to them. So it's molecular biology is helping to understand them how the disease is there. Molecular biology is not only the parameter that we can go through and that we can detect in early detection, but there is a need of the certain thing. Molecular biology gives the idea the how the disease will progress. So it gives so many things to the clinicians, what to do to our patient and what is the diagnosis of the current disease. So invention of the PCR and the Human Genome Project has made the journey of the 20 years, and where the PCR requires several basic components. So these are the things that requires for the medical laboratory person. But you people are the pathologists, some of the clinical side, some of the pathology side. But as far as my understanding is there, not to go into the technicality. But as far as in my hospital or whenever I have to give the presentation, I always give emphasis. Only the things should be know that the basic thing you must know that. Not to go to the technical part. This how the PCR runs. What is the technicality? But what kind of result gives the PCR? It is very important. It is any kind of the clinical persons who is belong to the Ayurveda, belong to the Unani, belong to the modern medicine, they need to know that what is the molecular biology gives and what is the answer of the test. So and what are the materials being used in the PCR technique? It is for the laboratory person. They should know about the technicality and the use of that thing. Yes, this is very important. Now that your journey starts from this, the need for the molecular biology test. So why there is need? So these are the options where we do the testing. This is the prenatal testing. Prenatal testing before when the baby is in the womb. And what will happen? What is the future of the baby? Will have any problem like the Down syndrome, aneuploidy, and so many things. So these things are required. The ultrasonography and the several biomarkers are there which is related to the blood. But the biomarkers have some limitations. Each and every aspect of the technique has some limitations, and the add of the molecular pathology gives the better picture. Suppose when we wear a glass, we can see the good picture. When we don't see the glass, we have the hazy pictures. So what gives the molecular biology? Molecular biology, in addition of all techniques like the ultrasound, blood testing, give the additional feather to understand the situation to the clinicians. So prenatal testing is the baby healthy. So not only if we say that it is only the molecular test. Suppose the Down syndrome should be done to the PCR testing. It is okay. No, it requires so many tests. I just want to use equally definition. And the same thing is that disease predisposition means what is the patient risk for? Risk for means suppose we are having a lot of stress. Would I be the diabetic in the coming 10 years? Yeah. Anyone who is suffering from different kind of the disease, so whether the cancer will develop in them. So it is like that. But you heard that the BRCA1 and the BRCA2 genes. I think you people have heard. And usually it has happened in the case of the Bollywood heroine Angelina Jolie, in which their parents had breast cancer disease. And what happened to the Angelina Jolie? Angelina Jolie does not have any kind of the disease and not she suffering from the disease, but it has been known that since their parent, their mother, has the breast cancer disease, there is the chances of there is a risk that the Angelina Jolie could develop the breast cancer in the future. So the BRCA1 and BRCA2 testing, these are two genes were there. It was tested and it was positive. So just because of the positive, the effect to me and 10 years back, science is different. Coming at the present scenario, science is totally different, and in the future 10 years, after 10 years, the future will be a different science. You must have seen in the soul cases. So it gives the BRCA1, BRCA2 testing is the only the risk factor. Whether you will develop the breast cancer in the coming scenario or not. It is not BRCA1, BRCA2 testing positive. It doesn't mean you will have the cancer. It is not surety is also there. After the removal of the annular tubule, it has been cleared that we should need to watchful, and there is no need to remove the breast and the ovary of that lady. It went wrong. So there is need to watch that the BRCA1, BRCA2 is positive. Then there is need to watch and what would be the present scenario, and so many testing should also be done. In that condition, try to preserve their organs. To preserve their organ is very important. And the third is drug selection. It is very important. It is very important because we are not doing that. Which drug will be suited to the which patient? Suppose in your medicine, suppose you are giving the same drug to the same people suffering with the stomach problem or any ulcer, colitis or some other problem. The one side of the patient will respond to that drug and the other patient is not responding to that drug. So this is the question that what is happening, scratching the clinician that what is the problem? That my one patient is responding with this drug and the other patient having the same disease is not responding to the same drug. So in this connection, there is the great role of the molecular biology has emerged. And finally we knew that there is the certain receptors. Like in you can understand the example of the in homeopathy, what the similar patient having the same problem, but the drug choice of the drug is different by the clinician. It is if the patient is bulky, fatty, and if the patient is lean and thin, color of the patient black or white, then the same disease, same drug will differ. So that is the modern science, the molecular biology is realized that what is the problem, why patients are not responding to the drug and why the drugs are responding to that patient also having the same disease. So receptors are there. Are you acquainted with the receptors? Every cell has the surface, some receptors, and they receive the signal of anything, whether we are giving the drug and the drug, how the drug pharmacogenetics, the drug combines with that receptor, and that receptor will work according to the DNA polymerization and the other things. So whenever the receptor is not there, the particular drug will not work. So drug selection is that, suppose in the case of the cancer, you might have that the people received the chemotherapy and some of the patients responded and some of the patients did not respond to the drug. Okay, so in that condition, our hospital, what we do or what the what before we give any kind of the drug, we examine the patient whether the certain genes are present in the drug. Certain genes means like the patient suffering from the lung cancer, so in which epithelial growth factor receptors are there, EGFR. If EGFR is present in it, then we have to prescribe the certain medicines. If EGFR is not present in that patient, although patient suffering from the lung cancer, and some of the patient is some of the patient have the EGFR receptor, then receiving the same group of the drug, and the patient who does not have the EGFR receptor receiving the different medicines. Then we go for the another testing, which is known as the ALK testing. If ALK is negative, we go for the ROS testing. If ROS is negative, we go for the red testing. Similarly, in a single patient, if we are assessing that there are so many receptors and so many receptors and a series of the receptors are not present, then the clinical used to give the chemotherapy. Then this is the starting of the molecular biology. What the clinical, what is the scenario between the clinical and monitoring, recurrence monitoring. So you have seen that in so many cases, you give the prescription for the hepatitis B for the patient, keep monitoring, isn't it? Have you given any of the time the hepatitis B testing from this college through the real-time PCR or the PCR testing? Because the two are the antigen and antibody testing, and we find that how the antigen and antibodies are working and what is the pitfalls of the antigen and antibody testing regarding the infectious disease. So recurrence monitoring, how the disease returns. So it is very important. Once the disease has been finished and cured or controlled, then after the some of the times, after 5 years, it has been seen that the disease comes back, it returns. So in that condition, we need to watch time to time whether what is the scenario in our body, whether the disease is recurring or not recurring. The chances of recurrence is there or not. It is most of the time in the cancer patient has been seen that once the disease has been controlled, it comes back and in a very aggressive manner. So it is very difficult to treat the patient. So it is very beautiful part. So we monitor the patient through the molecular techniques like the leukemia, the blood cancer, the different kinds of the 4 types of the blood cancer. CML chronic myeloid leukemia, CLL chronic lymphocyte leukemia, and ALL, AML acute lymphoblastic leukemia. Prevalence of the CML is a much in all three, in respect of all these. So CML, the PCR testing is there. One of the gene is there. At the PCR, present, the BCR positive patient receive the image. Or regressive. If the disease progresses, then there is disease. And it should be done. Prevention is also there. If you give the antibiotic for a longer period of time, it resists. So suddenly, so many drugs are who resist at the stem of the time, like the blood pressure medicine, diabetic medicines have the some resistance. Suppose you are taking the a kind of the drug related to the blood pressure, related to the other disease, 10 years, doctor remove that medicine and prescribe another medicine. That is why that drug has become resistant. So we need to know before, we need to know that when the drug will resist, we need to know, understand through the molecular pathology is what is happening inside the body of the human of the suffering with the particular disease. So this is the recurrence. And the transplantation medicine, kidney transplantation, it's a very good example in which the HLA testing is there. HLA testing means if the kidney will be transplanted, whether the transplantation will accept by our body or it will be rejected. So it is before transfusing the blood. So simple example, before blood transfusion is also a kind of the transfusion. So in which what the technician do? Technician match the blood of the one person and the recipient and the donor. When it if there is a chances of the no detection, then the blood transfusion has been done. So kidney is a major organ. It has to filter the so many things. If in that condition, if the molecular testing is not done, like the HLA or other thing, so transplantation should not be done. And it is very important. Infectious disease. The role of the molecular biology in the infectious disease is a very, very important. Nowadays, anything which is related to the diagnosing and identifying the disease, so molecular biology is working like Brahmastra. None of the technique which is available is as good as the molecular biology technique. Suppose the hepatitis B, hepatitis C, HIV, HPV, coronavirus, you have seen that so many tests introduced in the market apart from the real-time PCR technology, but the accepted and the gold standard method is the real-time PCR technology. So pathogen detection is only dependent on that whether the infectious disease means the particular virus or bacteria or any parasite is present in the particular patient is not. What happens in the antigen antibody testing? Antigen antibody testing is usually done in the case of the infectious disease. So are you satisfied with the infectious antigen antibody testing? It gives all the time the correct result, or many of the times if the false positive and the false negative results. So these are the subject in which we need to debate and to understand that is there any need to obsolete this antigen antibody testing, because it is very easy. Antigen antibody testing is easy to do, easy to perform, cost effective. That is why it is applicable in the medical science. So what got there? Because the invention of the PCR and availability of the PCR was not there. That is why from the clinical side, people the clinical reluctant to write the test from the HIV, hepatitis B, C through the PCR technique. What was the problem? Because it is costly. Molecular biology test is quite costly in comparison to antigen antibody testing. Antigen antibody testing for hepatitis B is say example for 300 to 1000 it gets completed. But when it goes to the molecular biology, it is around the minimum cost is 2500, which is 3 times of the present technique. But what is the drawback of this technique? This technique, antigen antibody, because several antigen is present in our body and several antibody is present. So how the antibody, if the foreign particles enters into our body, in that after some times, our antibody generates. So suppose so many viruses, so many bacteria, which is not known by the human being. Suppose coronavirus is known. After that, so many viruses are also present in this hall, but we are not known. We are infected at every moment with a certain bacteria, certain viruses, and antigen antibody is all the time is producing in our body. So it is not known which antibody is so HIV related, which antibody is particularly to hepatitis B related. So in that condition, chances of getting the result of the infection marker to the antigen antibody is more high, and the false positive and the false negativity is there. So many of the time, the false negative, we get the false negative result, and many of the time the false positive result. So in both the condition, patient has to pay the double money. If the result is positive, so no clinician, no one has right to give the treatment without doing the molecular testing. It must have to go through the PCR testing. If the result is there, then they write the medicine or the whatever treatment protocol is there, then it should be started. So when you have to write the prescriptions, you need to know that whether the patient is affordable. You need to understand it is the discretion of the clinician who has to write the prescription whether the person is affordable or the molecular biology test is cost effective, so first of all, you need to write the PCR testing because we have the false positive and the false negativity through the antigen antibody testing is much higher. And so many times the patient is suffering with a different disease. Patient is not suffering from the HIV. Patient is actually suffering from the different diseases like the lupus arthritis and the different other diseases. But the producing of the antibody is the same, which is the producing of the antibody in the case of the HIV. So are you getting my point? So what happens if the patient is suffering from the HIV and the antigen antibody testing is done, but actually the antibody is produced in different forms and the patient is suffering, actually the patient was of different disease. Suppose while the most of the hepatitis B, C patient detects at the time of the pregnancy, do you have any idea? Any from the gynae side? Do you have any idea that you will see it is the topic of the research when you go for the any from the pathological side or analytical side who are sitting here, you need to observe that at the time of the pregnancy, whenever the hepatitis B, C, HIV markers are necessary to do, and so many times it has been seen that the patient is positive with the hepatitis B, with the hepatitis C, and doctors and the patient both are surprised. Then what to do? How we got the infection and the serious infection? If any ladies is at the time of the pregnancy got infected with the HIV and HIV is positive, then it's so many the social taboo and the stigma is also there. How it happened? But it is not like that. So as the sperm goes into the female, that is the foreign body. And so many times the female, whenever they in the during pregnancy, so many antibodies also develop, and that antibody is similar to the different infectious marker. So it gives the false idea. So in that condition, there is need for the another testing. So suppose the doctor prescribe for the another testing takes another time. Whenever the result has not come, so that period of time, patient and doctor got worried, and so many questions comes in their mind how the patient got infected. The patient also thinks that how I got infected. So these are the two things. So it's better to have the PCR testing so to give the better result. Yeah, and the second is the NAT testing in our blood bank. So when the blood has been transfused, so it has been seen that the NAT, nucleic acid test. So what is the nucleic acid test? It gives the idea through the molecular level whether some of the time if the patient is suffering from the HIV, and that is the window period. Are you acquainted with the window period where the infection is there, but it is not shown by the test? Okay, so these are the 0 to 3 weeks in which it has been seen that the patient is suffering with the any kind of the infection, but it is not a detectable level because it takes time for detection. But the virus is there. So beauty of the PCR test is that since the virus is there, so we can identify and we can check that the particular virus is there through this technique, through the PCR test. It enhances in the millions of copies, like our photo Xerox machine. What does our Xerox machine? It gives the number of copies in multiple cells. Suppose I have the one copy, I can make 1,000 copies. So similarly, the PCR, if the disease is present in a single cell, it is not detectable. None of the techniques is available to detect the single cell is having any disease or any kind of the problem in it. So what does the PCR? It makes the copy and it gives the big picture of that single cell, and through that we can understand the patient has the particular virus in there. So it is beautifully what happens in the case of the corona. In the case of the corona, that time whether we need to know that whether the virus is there or not. But only thing is that the other thing is not there. So but it failed is not performed by them and only the gold standard is there. So these are the so that testing is similar. Before transfusing the blood to the patient, the antibody testing was there. But need to know that whether the HIV HPC was actually in the blood was there or not. Infection, most of the time it will be seen that how does the infection occurs and people get infected with the different kinds of the transfusion, blood transfusion, because in that condition, good amount of the blood, 300 cc blood is transfused to the patient. It means there's so many virus, bacteria, chances of the. So if you are living with the HIV patient, and living with the hepatitis B patient, it doesn't need the blood, the infection will contaminated or that will happen before getting transfusion to anybody. The NAT testing, nucleic acid testing, is very essential. If the government is also making the policy, but the things are there in our country where the cost of the blood got high. So in that, difficult to have that blood, but it is not. It is our research that how the molecular biology testing should be the cost effective. We are doing and we are giving. We are planning. Suppose like in the case of the COVID, the COVID test was started at the cost the rupees of the 4,500. Now the with the so many tests have been done. It has become the COVID testing has become the only the price beauty of the testing is that they know that okay, it will have the better answer on this test and the results of the test will not higher, then the cost will also get down. Yeah, I'm showing you one of the paper is published as I told you that how the false positive and the false negative result it happens in the case of the HIV. So the paper is published in the Chinese Medical Sciences in which the false human immunodeficiency virus get result associated with the rheumatoid factors in rheumatoid arthritis. So it's a very important. Actually, the patient was suffering with the rheumatoid arthritis. Okay, so the antibody developed is similar antibody developed like the HIV virus developed. So it is like that disguised people are there. Okay, so in that condition, patient got the HIV positive result, and it has been ruled out through the molecular testing. This is published, and it is a fact. So, in a nutshell, now we want to say that the molecular pathology is related to understand the disease, how the disease is progressive, how the disease is diagnosed, and what to do. And if you are thinking that the molecular, we need to obsolete all the tests or discard all the tests, so it cannot be done. We need to do through the different testing method and along with the molecular biology because the human body is so complex. In the present scenario, we so many science have developed, and whatever the result comes to the clinical table is very few. Every day we need to understand how the pathway is different, how the different pathway is useful. Suppose the Unani medicine has the different role. Molecular medicine has a different role. Modern medicine is giving the different ideas. So, as per the engineering science and the medical science, if you compare, then there is a huge difference between them because human body reacts person to person. Our body, our function, our parameter is totally different. Our blood pressure is totally different. If I am healthy in whatever the parameter, so-called parameter, like the blood pressure, like the diabetes, so whatever is written in the textbook, that is the reference. But clinician have to understand whether patient is in good condition or in the bad condition. They need to understand. So discussion of the clinician is to understand the disease in a better way is a good practice. So these are the study of the molecular biology in the different kinds of the disease and the detection and how I have described. So if you have any questions related to the whatever I talked, then it is welcome back. Any question? Because whenever I will not have any question, I have not understand. I have understood what I told. So yes, bro. Yeah.
हमको ये समझना है एक ये कि पीसीआर टेस्ट जो है वो कॉस्टली हो रहा है तो जो गरीब पेशेंट है उनके लिए किस तरह के सुविधा दिया जा सके इसके लिए समाजी या
That's a very great question, very good question, and it is asked by the many of the clinicians that that is why I have told in my that it is how the price should be cost effective. तो इसको कम करने के लिए क्या करना चाहिए? तो आप किस टेस्ट के बारे में पहले बता रहे हैं कि किस टेस्ट इन्फेक्शन टेस्ट के बारे में कहने जा रहे हैं या कैंसर से रिलेटेड टेस्ट के बारे में? Exactly. This is infectious disease. देखिए तो क्या है कि there is a marketing of everything. ठीक है? ये नया मोबाइल आपके पास आया है. ये मोबाइल सपोज कीजिए कि ये अभी आपको सपोज 25,000 का मिल रहा है. 6 महीने के बाद इसका प्राइस बढ़ेगा कि घटेगा? उसके यूज के हिसाब से. लेकिन मॉलिक्यूलर बायोलॉजी टेस्टिंग में क्या है, अभी ये नया है. हमने आपको उसका रोड मैप बताया. 3 से लेकर 2003 तक ये डेवलप किया है साइंस. ठीक है. ऑल्दो मेडिकल साइंस जो है, मॉडर्न मेडिसिन चाहे आयुर्वेद, ये सदियों पुराना है. तो इसका कॉस्ट है इस साइंस को. तो इस साल के साइंस में हो क्या रहा है हमारे आपके बीच में? मार्केटिंग. जो कंपनी डेवलप करती है जो पीसीआर की टेक्निक्स, तो जो अवेलेबल मटेरियल कराती है, वो जानती है कि क्या हमको इससे अभी कमाना है. और दूसरी चीज क्या है कि आप जब कोविड के केस में देखें, हमने भी बताया कि कोविड का कॉस्ट तो पेशेंट के लिए शुरू में आया था वो 4,500 6,000 तक था. लेकिन जब वो रैंडमली होने लगा तो कॉस्ट हैज बिकम डाउन. ठीक है. तो वो घट गया, 700 रुपए पेशेंट को आ गया. तो अभी क्या है कि व्हाई आई एम सेइंग कि आई नीड टू स्टैंड दैट market for the clinician is very meager. Okay, from the modern medicine like the MBBS MD, Ayurveda, because it is not their curriculum. उनके करिकुलम में बताया ही नहीं गया और एक है कि साइंस आ गया. तो है ना, अगर कोई टेस्टिंग हमको मिल गई है ना, टेस्टिंग मिल गई, ठीक है, whether the patient is positive negative it doesn't matter, we have the report, है ना. What is the thing? But the very few clinical persons are the research oriented or research minded. I'm very pleased and very happy that the Imani Medicine, the degree college, has started the research skills. Research skills, it doesn't mean you invented something. It doesn't mean research. This means you discovered a drug and the drug is very high, you got a Nobel Prize. It doesn't mean you treating the patient in the research manner. Whenever, how many times the clinical person treat the patient like the research subject? Not a single time. Not saying every clinician, every practitioner becomes so commercial. If the patients come to their clinic, they don't have time. So what is happening in their body? Oh, reports are there. It is increased, increase the dose of the drug. It is decreased, eliminate the drug. This is not a practice. You need to understand, do the research with the patient. Then that there is a need of the such drug with the patient or not. If suppose I'm worried, my blood pressure got raised, and I visited to the clinical person, they see that oh, blood pressure is 200. Right now, give the medicine. But they didn't ask me, why? Is there any problem? They don't have time. So you people, when they're doing the research, then clinical practice, then do the patient in the research manner. Treat the patient in the research oriented. Because you think that it is your subject. You need to understand. I've said so many times where the drug is required or not. Because very few people are required the drug. But this is not understood by the many people because drug has become our marketing. If the drug is not there, the economy will not rise. So drug company, pharma company, and so many things, but the charity and the research is not there. So I expect that whenever I give the lecture to anywhere, I emphasize to the clinician that you need to understand your patient in the research subject and give that drug in the least amount. Drug is not necessary. Every drug is present in the environment, in the form of food, in the form of like you people do in your practice. It is the best. Unani medicine is the best. Ayurveda is the best. But whenever it has become the commercial, it will be difficult. The practice is done by the modern medicine practitioner is not there. There are only the chemical is there. Like suppose if you are having the vitamin A, vitamin B, vitamin C, all these are the synthetic. There is no need to our body. But people used to give and the patient love to have that drug. So I am taking vitamin A. It will be good for us. No, it's not good for you. Your liver is not to the urine. तो ऐसा भी नहीं कि ज्यादा लेकिन नहीं, it is not. Your liver is there. It is your own liver. Every drug, every food has to encounter with the liver. So liver is affected. If you are taking all the wrong medicines, okay, so it will be after writing the discussion and the exactly.
तो मशीन अगर गलत रिपोर्ट दिया तो सही रिपोर्ट दिया तो ये इलाज हुआ, गलत रिपोर्ट दिया मरीज को बीमारी नहीं है तो
yeah, I'm saying that it's a very good question कि it is purely machine based. So एरोप्लेन जो चला रहा है पायलट, ठीक है, अब एरोप्लेन चला रहा है पायलट, वो समझ आता है हम क्या है okay 2% time there is a chances कि एरोप्लेन got crash है ना, प्लेन क्रैश करता है तो प्लेन का चांस तो ठीक है, इस our internal control. If that internal control has developed, then we give the result to the patient. If that internal control has not developed, we don't give that. The chances of the getting the false positive, false negative through the real-time PCR technology, other the techniques, is very, very meager. Okay? But despite of that, if the now the role of the clinical is always higher. the clinical person who is treating the patient, if they receive that false positive or the false negative result, they understand that is that any need to review the result? Is that any need to go for the further treatment? So it is the discretion, ये उनकी सोच है, the clinical person who are sitting. That is why I am saying that the clinical persons have to think many of the times to go forward in the way of the treatment of the patients. So these are the answer of my question.
Thank you, sir.
Any more? Yeah, please ask something because it's a very new science, and I think that I need to make you understand that okay, what is when you will not understand this science, you will not write in your practice. And I think that okay, every clinical person, like you people are sitting here, should write in the practice because it is much beneficial for the patient also.
Hello, sir.
Yes, yes.
So my question is like I want to answer understand that the PCR test करते हैं sir हम लोग तो does it detect a particular virus के हाँ इसको hepatitis वाली बीमारी है या फिर इसको cancer वाली बीमारी है या ऐसा कुछ when we do PCR test does it detect the particular disease and how does it detect the particular disease I want to
Suppose आप ये कहना चाह रही हैं if patient is suffering from any hepatitis B, hepatitis C, HIV or any other things, है ना? So how does the PCR detect? ये कहना है आपको ना? Yes. And what are the tests available? That is, I have told you that okay, antigen antibody tests are also there, which detects that okay, whether that virus is there. So antigen antibody doesn't give that the virus is there enough. It gives the idea that the antibody developed by the virus is or not. So I have shown you the paper and I have shown you that so many times the antibody is the wrong feedback. Okay, and what PCR does, PCR gives only that the particular virus is there or not. Okay, suppose anyone outsider comes and sitting behind you. Okay, but you are not doing that person. And morphologically, for viewing that everyone is there, everyone has the stethoscope. It means that okay, I understood that okay, everyone is a clinical person are sitting there. Okay, so how we will understand? Whenever we will not ask them, yes, what is your name? Do you have any degree? Do you know that these are things? We will ask some question. Similarly, PCR. What is the PCR? If the virus is there and the virus is in a very small amount, virus cannot be seen through the microscope. Are you sure? It cannot be seen through microscope. Virus, the size of the virus is so small. It can be amplified. Whenever it cannot be amplified, it cannot be detectable. So, suppose a single copy of the virus is there. So, what does the PCR? It makes the several copies, millions of copies. है ना? एक है उसका 100 करोड़ कॉपी बना दिया. अब 1 करोड़ कॉपी बना दिया. अब उसके बाद क्या देखेंगे? Amplification, expression. उसका expression आया कि नहीं? अब this expression is there, then it means that the virus is present and the patient is diagnosed with particular disease, like in the case of the COVID. None of the testing was perfect. Have you seen in the case of the COVID?
My question was like, does it detect a particular disease or virus?
Particular virus, not disease. Yes, that's a good question. It doesn't mean if they are detecting the HIV virus, so we don't have to concern with the particular disease or acquired immunodeficiency syndrome, AIDS. We cannot say that. AIDS and detection of the HIV is a two different things. Hepatitis B and the liver problem is a different thing. Liver cirrhosis and other things are different things. We are only detecting the particular virus of certain diseases. Or not a particular disease, a particular virus is there, but we cannot identify it. So, to rule out the particular disease, we need to have the different kinds of the test processes. We can give the result to the patient. Not only molecular, I always emphasize that the molecular biology gives the better idea, more answer to understand the disease. Suppose the journey starts of the investigation, whether the problem is there or not. It means a virus, if the patient is suffering from any infectious disease, the particular virus, suppose like the malaria parasite. So how many times you have seen in your practice is that the patient got the positive input through the microscopic examination? Not a single time. Clinician used to give the result just because patient was shivering, patient was a high fever, and they prescribed the dose of the malaria parasite. Although the patient did not develop any malaria parasite symptom, and a patient had no malaria parasite in their blood. So it can be ruled out through the PCR testing whether the malaria parasite gene is there or not. If the malaria parasite gene is there, then yes, we are saying that the patient is suffering with the malaria parasite and it needs the malaria parasitic antidote. These are the value of the thing because it gives the exact idea. Whether these are random treatment, most of the time we used to give the random treatment. We don't know whether the patient is actually, it has been seen that the stat drug. Malaria parasite, the patient used to give the stat drug. Patient, because the patient was shivering, the fever was 102, 103, so high. So it is assumed that the patient is suffering with the malaria parasite, but although the patient did not have the malaria parasite, so in that condition, wrong medicine was there, and ultimately what happened? Liver get damaged. So what is the problem? Liver is the first side that we will have to see the lot of the problem. Okay. So satisfied with my answer?
Yes, sir. Thank you so much.
Okay.
Assalamualaikum. First of all, I would like to thank you for delivering a very informative lecture. So my question is that what is the role of DNA methylation in gene regulation? Please shed some light on it.
DNA methylation is a totally different thing. Diagnosing and the different thing. DNA methylation जो है वो आपके disease के progress इस तरह से जैसे suppose कीजिए कि you are having the any kind of the mutation. Yeah, mutation is there. So and the DNA is the A, T, C, G. These are the nucleotides, and the sequence of the A will combine with the T and C will combine with the G. It is there. Then the DNA methylation is there. See how the DNA, if the mutation is there, suppose that the sequence is A, T, T, C, G, and the next sequence, the second strand will be the complement of A will be the T, and the complement C will be the G. And it has been seen that the sequence of the first A, T, C is G, 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 and the next is the sequence of the is not present, and because DNA methylation is ATCG is what is the amino acids, and it is amino acid in the problem where the mutation is there. It may be the chances of the point mutation. Single SNP, single nucleotide is not present, and suppose in many of the times the deletion is there, the second is not deleted, or addition or insertion, then it can be a DNA methylation to happen, and the DNA next. So what happens? DNA has the power to repair its gene. So repair mechanism is also there. So repair mechanism in the gene repair mechanism, and what happens as DNA gets DNA denature itself, DNA damage itself, but the repair mechanism will not damage. Whenever DNA repair mechanism will go to repair the DNA. So in that condition, that when the A, T, C, G get damaged, then this is the problem of the methylation, and then we have the wrong feedback of the gene sequencing. And it has been most of the time it has been seen that the DNA role of the methylation in the field of the cancer patient, there are so many mutations are there. So this is the answer of the question. Any more? Valsan?
रिजल्ट आता है कोविड-19 पॉजिटिव या नेगेटिव, ठीक है। तो अगर हम तीसरे का पूरे सेल का करा रहे हैं, सेल का करा रहे हैं, तो उसमें सिर्फ हमें जिस डिजीज के लिए पीसीआर करा रहे हैं वो इंफॉर्मेशन देगा, या फिर जितने भी फॉरेन बॉडी है उस सेल में या बॉडी में वो सारा इंफॉर्मेशन
नहीं, only for कोविड-19।
तो ये कैसे पीसीआर पूरे सेल का करा है, वो एप्लीकेशन
नहीं, हाँ क्या है, हाँ हाउ द पीसीआर वर्क्स अभी आपको बताते हैं। कि पहले क्या किया गया कि ये वायरस के जैसे जीन के बारे में हमने बताया, जीन है ना, डीएनए है, डीएनए में एक पर्टिकुलर सीक्वेंस हुआ, 3' 5' प्राइम जो हुआ, उस प्राइम में सीक्वेंस है, यानी कि उसकी कोडिंग है, तो उस कोडिंग को हम लोग पहले पहचानते हैं कि क्या आपके पास वो कोडिंग है कि नहीं है। तो पर्टिकुलर वायरस लाइक हेपेटाइटिस बी वायरस, हेपेटाइटिस सी वायरस, एचआईवी वायरस, ह्यूमन पैपिलोमा वायरस, कोरोना वायरस, सबका डिफरेंट सीक्वेंस है। ये हमने क्यों बताया कि 2003 में जब ह्यूमन जीनोम प्रोजेक्ट हुआ, इट इज अ लाइक लाइब्रेरी। आप जब लाइब्रेरी में जाते हैं तो इतने सारे बुक्स हैं, ठीक है। अभी तो कंप्यूटर है, गूगल का है, आप गूगल में कुछ लिखते हैं तो वो सामने आता है। लेकिन अगर आप लाइब्रेरी जाते हैं तो आपको बुक का कैटलॉगिंग किया रहता है। पहले तो आप हैं कि हमको भाई चाहिए, हम लिटरेचर की बुक चाहिए तो लिटरेचर कैटलॉगिंग जाएंगे, उसमें भी चाहिए कि हमको पर्टिकुलर राइटर का चाहिए तो वो पर्टिकुलर राइटर का कैटलॉगिंग है। तो इसी तरह से सीक्वेंसिंग जो जीन का है वो करके रखा हुआ है सारे का, जिसको ह्यूमन जीनोम प्रोजेक्ट कहते हैं उसको। तो पर्टिकुलर वायरस को अगर पहचानना है तो उसकी पर्टिकुलर सीक्वेंसिंग है। अब उस पर्टिकुलर सीक्वेंसिंग को हम एज ए टेम्पलेट, ठीक है, वो जो ले लेते हैं और लेके फिर क्या करते हैं कि पेशेंट का होल डीएनए निकाल दिए। अभी हमको ये पता नहीं है कि पेशेंट का सीक्वेंस इतना बड़ा मिल गया हमको, और उस सीक्वेंस में हमको जो वायरस का जो सीक्वेंस मिला वो इतना बड़ा है, इट्स लाइक ऑफ दिस साइज, ठीक है। और पेशेंट का डीएनए निकाले कितना साइज का मिल गया, तो क्या होगा। तो अब ये पीसीआर क्या किया कि वो जो पर्टिकुलर सीक्वेंस था कोविड-19 का, वो कोविड-19 अब पेशेंट के जो सीक्वेंस के साथ वो खोजेगा कि हमको किसके साथ डीएनए क्या करता है, मैच करता है दोनों के साथ, कि किसके साथ जैसे ए टी सी जी जी, और वो ए टी सी जी जी हमारे पास है कि नहीं। जैसे कि स्नीफर डॉग को आप देखते हैं कि अगर आप उसको ऐसे ही दौड़ा दीजिए कि हमको किसी आदमी को पकड़ के लाना है, तो इट कैन नॉट बी डन, इट कैन बी डन ओनली इन द पिक्चर। कि आप देखते हैं कि वहां से कैरी निकला, यहाँ से कुत्ता भागा, कुछ नहीं होता जब तक वो स्मेल, आपका पर्टिकुलर स्मेल वो लेगा नहीं, ठीक है। वो पर्टिकुलर जैसे उसको हम सुंघा दिए बारूद का स्मेल, अब वो बारूद को डिटेक्ट करेगा वो पर्टिकुलर। अब उस बारूद में हम थोड़ा सा भी चेंजेस कर दें उसके स्मेल में तो वो नहीं कैच कर पाएगा। तो सिमिलरली वो आपके जो पर्टिकुलर सीक्वेंस है जीन का, वो जीन वो वहां पे हम एक साइड में लिए पेशेंट के लिए, अब पेशेंट के लिए इतना बड़ा सीक्वेंस था, उस सीक्वेंस में वो मौजूद है। अब दोनों एक दूसरे के साथ अटैच करेंगे। तो पीसीआर में क्या होता है, पीसीआर का जब भी रिएक्शन कैसे कॉपी बनाता है, पहले अनिलिंग, पहले डीनेचुरेशन होता है, डीनेचर होता है, इनके डीएनए का जो डबल हेलिकल है वो टूटे खुल जाता है, ठीक है। उसको हम डिफरेंट टेम्परेचर से उसको खोल देते हैं, खोलने के बाद उसको फिर क्या होता है एनिलिंग। एनिलिंग का मतलब कि ये जो मेरा जो कोविड-19 का सीक्वेंस था, वो कोविड-19 और जो आपके पास सीक्वेंस था वो उसके साथ जाके अटैच हो जाएगा। अटैच जैसे ही हुआ, अब फिर क्या करेगा कि वो मिलियंस ऑफ कॉपी बनाने के लिए मजबूर हो जाएगा, ठीक है। जिसको हम लोग डिफरेंट साइकिल्स में देखते हैं, जैसे एक साइकिल में थोड़ा सा किया, जैसे 2 की पावर जो है 2 की पावर इस तरह से बढ़ते जाएगा, 4 8 16 32, ठीक है। तो इससे बढ़ते 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 मिलियंस ऑफ कॉपी। अगर हमको लगता है कि अगर कभी कभी वायरल लोड कम है तो जो हमारा जो कॉपी बनना है वो एकदम लास्ट एंड पे जाके बनता है। जैसे पीसीआर साइकिल हुआ, आपने सुना होगा कि 45 साइकिल्स का होता है, 35 साइकिल्स का होता है, लेकिन जब कभी कॉपी बना तो हम कहाँ पे बना, 30 साइकिल्स पे बना, 30 साइकिल्स से बन के 35 साइकिल्स पर एम्पलीफाई किया है। तो इट मींस वी कैन से दैट कि वायरल लोड इज प्रेजेंट बट इज इन लीस्ट अमाउंट, कम है। तो ये तरीका होता है पीसीआर के काम करने का। ओके, any question? Done? Should I leave? Because awareness speaker Dr. Arun is also here. He's sitting here for his presentation. Thank you very much for the patience and also the question and answer scenario. Thank you very much.
बहुत बहुत शुक्रिया सर। ये थे डॉक्टर मोहम्मद अली सर, बहुत ही जाना पहचाना चेहरा हम सबके लिए। आप सीनियर साइंटिस्ट हैं महावीर कैंसर संस्था में। सर मॉलिक्यूलर पैथोलॉजी पर हमसे बात कर रहे थे और मॉलिक्यूलर टेस्ट की क्या अहमियत और फायदे थे, खासतौर से किसी डिजीज को डिटेक्ट करने में और ड्रग के सिलेक्शन में और मॉनिटरिंग में वो तफसील के साथ आसान लघु लेने में बात कर रहे थे। बहुत बहुत शुक्रिया सर का। और इस तरह का लेक्चर बहुत कम मौका मिलता है हम सबको सुनने का, सर ने हम सबको वक्त दिया, इसके लिए फिर से सबका शुक्रिया अदा करता हूँ। आज जो है महावीर संस्था की मेहरबानी है कि आज हम लोग इस तरह के दो लेक्चर्स के साथ कर रहे हैं। बहुत बहुत शुक्रिया। हम अपने साल के साथ कि उसने वादा किया है आने का, उसने वादा किया है आने का, रंग देखो गरीब खाने का, हर गली अच्छी लगी, हर एक घर अच्छा लगा, वो जो आया शहर में तो शहर भर अच्छा लगा। बहुत बहुत शुक्रिया सर। अब मैं मजीद इज्जत अफजाई के लिए और शॉर्ट पेश करने के लिए इसी कॉलेज के सर शमीम अख्तर सर, पैथोलॉजी डिपार्टमेंट में असिस्टेंट प्रोफेसर हैं, सर से दरखास्त करता हूँ कि सर प्लीज तशरीफ लाएं और सर को शॉर्ट पेश करें। अब मैं सर के बाद अपने कॉलेज के प्रिंसिपल सर से मैं गुजारिश कर रहा हूं कि सर प्लीज सर को मोमेंटो पेश करें। बहुत बहुत शुक्रिया सर। अब मैं स्पेशल थैंक्स के लिए मैं डॉक्टर तनवीर सर, असिस्टेंट प्रोफेसर डिपार्टमेंट ऑफ पैथोलॉजी व समाजी थी प्रिवेंटिव एंड सोशल मेडिसिन को मैं दावत दे रहा हूँ। सर प्लीज तशरीफ लाएं और शुक्रिया अदा करें। Thank you, Dr. Rajesh. Special thanks goes to Dr. Mohammad, the molecular scientist and Mahavir, Texas, Sanathan. Thank you for this lecture which was on the 3 milestone of the molecular biology pathology. He told us about the double helix structure of the DNA and the story behind that, how the fortunately stolen the idea from a lady who went, I think, she went through some pathology because of that. It was quite evident that these are the things which are updated. We told it Adhatan in the Hindi. Updated test, especially the molecular test, their applicability, and the comparative analysis in the matter of the cost and efficacy with the antigen antibody test, PCR test. Sir, you elaborately told us about the applications of prenatal testing, how it is beneficial in the case of the female, and the disease predisposing, what are the importance of this test, the disease detection, disease and drug selections, and the recurrent monitoring of the reoccurrence and occurrence of the disease. We are going through the era where the re-emerging diseases are on the high. That's why these are the tests which require to be done before, and in the case of where we are concerned about the well-being of the patient, the well-being of the own self. We here in this college, we are working on a project which is called Alamate Manzara. In that case, there are some things which are mentioned in Nani, where we usually predict the disease on the current patterns and the signs of the individuals. Although it was written 1,000 years back in our books, but we are going to synchronize all those things, and we will try hard to correlate with the recent monitoring, scanning, and all those tests we are being done over here. We told about how these tests are efficacious in detecting the chances of organ transplantation resection. These are the things which are being applied over here. There are so many chances where the organs are being rejected at the time of last time. So that was, these tests are very relevant. We told about how we detect the HIV and HCV earlier through these tests. So with these words, I would like to thank on behalf of this college, the students, the PG scholars of the recent batch, and the principal sir. Thank you so much, and definitely we'll be having more lecture regarding all these type of I think topics, and moreover we will try our work to correlate and will participate in partnership in these things. How we can develop a thesis, how we can develop a project collaboratively over these things, because we have some
kind of alamat by science in our books, which predicts the disease after 15 years and 25 years. So we need to connect with the current science, and in future we will develop. I hope we will develop such kind of project together. Thank you very much.